Del Labelle at Alexion, where we work to transform the lives of people affected by rare diseases and devastating conditions. My colleague Will Lumpkin is joining me to reflect on how we see the broader economy and economic drivers impacting health, especially to the most vulnerable populations, in this case, patients with rare and devastating diseases.
Thanks, Dale. The COVID pandemic made it necessary for our business to stay nimble and stick to our mission. Not only were patients unable to access face-to-face services, many were also facing financial trouble. Our OneSource Patient Services team was a critical link for many patients. We provided phone and email services to help navigate benefits, coverage, and other continuity of care resources that were badly needed during the pandemic.
Thanks, Will. I think what we have seen is that the needs in so many communities go beyond the pandemic. A vibrant economy and a reliable public health infrastructure are both must-haves for a healthy community. Thanks, Will, and thanks to the Alliance for Health Policy for sharing our take on the topic of health and the economy.
Hello and welcome to the second session in the Alliance's 2021 Signature Series Summit on Health and the Economy. I'm Dan Gorenstein. I'm the host and executive producer of the health policy podcast Tradeoffs, and I am your moderator for this session. You can join today's conversation on Twitter using the hashtag AHPSummit21 and follow us at All Health Policy. We want you all to be active participants, so please get those questions ready. Here's how you can do that. Navigate yourself to the chat box on your screen. You can use this feature to submit questions to panelists as well as seek support for any audio or technical issues you may be experiencing. Materials for this event are located on the left-hand side of your screen within the Agenda tab. Please select this panel to view details and extended speaker biographies. Now, I am pleased to introduce today's panelists. First, I'd like to introduce you all to Mike Murphy. Mike is Chief of Staff and Director of Fix Us at the Committee for a Responsible Federal Budget. In this role, Mike manages policy research and analysis on a variety of topics related to fiscal policy in the federal budget, as well as leading coordination of a wide array of projects related to advancing the committee's policy-related initiatives. Prior to joining the committee, Mike worked for the Comeback America initiative and also as a senior transportation program analyst for the Port Authority of New York and New Jersey, as well as in legislative affairs for the American Cancer Society and on Capitol Hill. Next, I'm joined by Dr. Mark Miller, Executive Vice President of Healthcare at Arnold Ventures. Mark leads Arnold Ventures' work to lower the cost and improve the value of healthcare. Prior to joining the team, Mark held several positions in health policy, including Executive Director of Medicare Payment Advisory Commission, Assistant Director of Health and Human Resources at the Congressional Budget Office, Deputy Director of Health Plans at the Centers for Medicare and Medicaid Services, Health Financing Branch Chief at the Office of Management and Budget, and Senior Research Associate at the Urban Institute. Next, I'm pleased to introduce Dr. Edmund Toye, Senior Economist and Budget Analyst for the state of Colorado. In this role, Edmund supports the governor's healthcare agenda, assists in the development of the state's budget priorities for Medicaid and the commercial health insurance sector, and helps publish the governor's quarterly economic forecast. Prior to joining state government, Edmund spent nearly 20 years in the public and private sectors, including the White House Office of Management and Budget, an economic consulting firm engaged in corporate litigation matters and health economics research, and the nonprofit Colorado Health Institute. Finally, I'm joined today by Hamie Tawarson, Executive Director at the National Academy for State Health Policy. Hamie joins NASHP from the Duke Margolis Center for Health Policy, where she's been a leader of the center's emerging state policy portfolio, including COVID-19 testing and containment, vaccine distribution and education, coverage and health system reform, Medicaid system improvements, and addressing equity within and beyond the COVID-19 pandemic. Previously, Hamie served as the director of the health division at the National Governors Association Center for Best Practices. She also has served as senior attorney for the Office of the General Counsel at the U.S. Government Accountability Office, addressing Medicaid and related healthcare topics for members of Congress. Thank you all for joining me today. I'm going to start off. We've got Mike Murphy here, he's hitting the lead off. And here's the question for you, Mike. At a broad level, what actions did the federal government take to respond to the COVID-19 pandemic? And why did the government make the choices that they did? What were they trying to achieve?
Oh, well, thank you, Dan. It's good to be with you. Good to be with the Alliance today. So what actions did the federal government take? Well, let me just start off by perhaps stating the obvious. Look, over the last year plus, the federal government has taken what is really unprecedented action in response to this COVID pandemic. And I think it's important to sort of also state another sort of fundamental point, that they're actually responding to two separate, albeit related crises, right? You had a public health crisis, which required one type of response, but you also had an economic crisis that required obviously a very different type of response, with the federal government having to step in to prevent the economy from a freefall when we had a forced shutdown that was going to have everybody out of work. So there was two very different crises that they responded to, and again, they responded in unprecedented ways. In terms of what the actions were that they took and how they made them, I think it won't surprise you, Dan, for me coming from a budget policy perspective, it might be helpful here to put some numbers to this to help sort of put a little bit around the magnitude and the sort of breakdown of how the government responded to this, right? From a magnitude standpoint, it's important to note, so the federal support and spending on this has come from generally three different areas, okay? You had a response from the Federal Reserve in a lot of ways, which through asset purchases, liquidity measures, did a lot to prop up the economy over the last year plus. You had actions taken by the Trump and Biden administration that didn't require any legislation, administrative actions that supported the response here too. An example of that on the economic side would be just delaying tax day. We can do without legislation. It's a lot of administrative response, but then there was legislative response, enacted policy through legislation, which is what I think most people are thinking about when they think of the response. And just to put some numbers on that, the magnitude, we've tracked that it's been about almost $6 trillion through a few pieces of legislation, $6 trillion to have been authorized in response to the crisis. About $3.2 trillion we estimate has been spent so far. In context, the year before the pandemic, the federal government as a whole spent in the fiscal year about $4.5 trillion. Okay, so it just kind of gives you the magnitude, size-wise, of the response. In terms of the actions they took, do a little bit sort of a breakdown here for you, right, to just sort of bucket some of the big areas of response here. Okay, forgive me if I look at my notes because we got a lot of numbers that I have here.
By all means, sir, by all means.
Biggest one, right? So through loans and grant programs, about $1.5 trillion through a variety of loans and grant programs. This is the PPP program that supported small businesses. You have industry-specific support and loans and grant programs for the airlines, hotel industries, restaurants. So a lot of support through loan and grant programs. Second, about $900 billion in income support, right, for folks, primarily through expanded unemployment benefits. Was a big primary means of that. Third, you had a lot of state and local funding support, right, to shore up state and local governments in a variety of ways, both to shore up revenue shortfalls, but also in specific areas, obviously in education, as well as support in transit as well. Fourth, direct payments, another about $900 billion there. Direct payments is just direct sending checks, right, to households. Then obviously, then you had healthcare spending. So everything I just said was more on the economic side. healthcare spending of about 660 billion that we've tracked, and that's where the spending for grants for healthcare providers, obviously vaccine development, Medicaid spending, and others. Right, and then you had a variety of other spending. But hopefully that gives you a little bit of sense of the breakdown, Dan. But again, I finished where I started here. The scope and comprehensiveness of this was unprecedented over the last year. And no, go ahead, Dan.
Yeah. No, I appreciate this. This is great table setting, Mike. You're and these numbers, I think, are hopefully giving our audience a really nice sense of the magnitude, as you said. And I just in a real simple way, what's the goal? You talk about $6 trillion, about half of which has been spent, but at a high level, in one sentence, what was the goal of that $6 trillion? To do what?
Prevent a deep recession and depression, right? With a forced shutdown of the economy. We needed to sustain individuals and businesses when we were forcing them to go in their home. That was more than one sentence.
I appreciate that, and really, it sounds like this was as you say, this was unprecedented action, and it was done with an eye towards propping up, supporting critical industry and business, and also individuals, families, to make sure that we avoided economic catastrophe.
Absolutely.
Very good. We're going to leave it there. We're going to move on to the next, but you have, sir, really helped us lay this out in a clean way. Thank you very much. We're going to get back to you in a few minutes here. I'd like to bring on Mark. And Mark, the question for you here is, what were some of the challenges with these federal actions that Mike has just laid out? Can you tell us about, in particular, we're really curious about the accountability and safeguard measures that were or were not really included in these bills, in the $6 trillion that Mike was talking about?
So my comments will be around health, because that's all I would know what to comment on. I think there's a few ways I would think about the word challenges, and I just think of that as, problems and shortfalls. So one thing is coming into the crisis already deeply in debt. I think part of the concern at a very high macro budget level, the notion of coming into the crisis where the debt we were carrying was equal to, I'm going to say, I think it was about 78% of the size of the economy. And after all this happened, the size of the debt is now, 100% of the size of the economy. And, a crisis like this, you might want to come into it, you do have to do deficit type of spending. But it might have been better to come into it would have been better, in my opinion, to come into the problem not as deeply in debt already. That's one thought. A second thought was your point on accountability. And there is this balance that's trying to be struck in the middle of the crisis, that people feel there is a public health crisis and an economic crisis, as Mike said, that people have to act and have to act quickly. And then there's this mentality of don't try and do anything, fancy, just let's try and maintain or get back to normal. Now, one thing I would say about getting back to normal is in the healthcare system, we had a lot of problems, inequities, cross-subsidizations, exposure on the part of, consumers, costs that were too high. The notion of wanting to get back to normal, I would question, and would take an opportunity like this to try and affect policy change in two ways. One, accountability, which you said, and there was a lot of help for providers that went out the door that ended up, I think, in general consensus, to help those who had resources more than those who didn't have resources. So large, well-funded systems, and I can get into this more on question, got bigger bailout, parts of the bailout, because we were replacing, or the Congress was replacing revenue. And of course, part of that revenue was really high prices that they were charging. So in a sense, we put money into the system and made the inequities worse, and also gave opportunities for certain providers, and even private equity firms were getting parts of this bailout to engage in further, use those or at least subsidize, some of the activities that they were engaged in, like consolidation and other actions like that. So there was not a lot of accountability. There was this rush to get dollars out the door. And the last thought I'll inject into this, if I'm still answering your question at this point, is I would argue that we should take the opportunity to also try and execute and leverage policy. So at this time, we were in the middle of the surprise billing debate, and we were offering providers bailouts who were engaged in very aggressive surprise billing activities. And one might say, in order to get this bailout, we would ask for things like don't engage in surprise billing. Don't, have the aggressive debt collection that we're seeing around some of the poor. Those types of things where you would tie strings to taking the money. If you take this money, this is what we would expect in policy. I'll stop there and ask whether I'm even answering your question.
I appreciate that, Mark. Real quick, I'm curious. You talk about this rush to get dollars out the door, and a lack of accountability. And I just wonder, and be quick if you can in the answer to this. What is hard about building accountability measures into these funding pieces of legislation in a crisis? Is that an easy thing to do or no?
No, it's not. It's not an easy thing to do, but there are ways to do it. So, for example, if you're going to go out and help a hospital, if you do it just on the basis of resources or revenue, maintain revenue, you'll get the result that I was referring to. I won't go through that again. On the other hand, what you could have done is said things like the all-payer margin. How many days of cash on hand? What are your reserves? And then had the money flow on the basis of hospitals who did not have a lot of cash on hand, were serving the poor, did not have a lot of fallback assets, and had more. And there was a shift after a couple of slugs of money. So you can do it, but it does cause, it requires you to pause and say, this is it. And what I would say in the middle of a crisis is at least what the Congress could have done more aggressively to begin with is to say, if they were going to offload this all to the secretary, at least declare principles in legislation of what they are trying to do. If they can't legislate down to, which I do understand, legislate down to this many days of cash on hand, which you may not want the Congress, involved in that level detail, but at least a clear statement of intent and principles of how they'd like the secretary, and then clear follow-on either through audits, general government accountability office, so that providers know there's going to be a look behind, or whoever takes this money, that there's going to be a look behind.
Thanks for that, Mark. Appreciate it. We're going to turn now to hear about how this money went from the federal level to the state level, and to help give us some insight into that, we're going to talk with Edmund here. And so, Edmund, the question for you is, what were the states doing at this time? Mike is talking about, you've got this dual crisis. You've got a public health emergency on your hand. There's an economic catastrophe brewing. How was Colorado responding to these federal actions and trying to manage these crises?
Yeah, thanks, Dan. We've all been using the word unprecedented, an unprecedented number of times, and I'm going to try to avoid using that term. But everything I'm saying here is really in that context of it. It's all unprecedented. So, I think the first point is, what was going on in Colorado as we've been working on the budget and thinking about all these healthcare challenges is, I think one way to describe it is this complete whiplash here. Last spring, as we were a couple of weeks from finalizing the budget when the shutdowns occurred, and all of a sudden we had to cut, the amount of revenue coming into our general fund was going to drop $2.8 billion. And our general fund is only $13 billion. So that's a 20% drop that we had to figure out how are we going to possibly handle this in a state budget where, we cannot run we can't borrow money. So that's what happened in May of 2020. Fast forward to this last March when we put out the governor's latest economic forecast. We, for the fiscal year of 21-22, which is going to start this July, we're forecasting a $2.1 billion increase in revenue into our general fund. So that's mostly reversing what has happened, but now we're in a situation where we have more money than we thought we did, and that's not even including all of this federal funds that was part of the American Recovery Plan, and we are going to be getting $3.8 billion for that. And that obviously creates a huge opportunity for us, not just to deal with the immediate problems, but also to figure out how we're going to use that in a wise manner. And so, I think from last spring, we all learned that cutting budgets are really hard. We cut Medicaid provider rates by 1%. This year, we're going to give them a 2.5% increase, which will help shore up what they're trying to do in this public health crisis. So as hard as cutting budgets was last year, I think the only thing harder than that is spending money wisely. And as we are in that situation to figure out, what are we going to do with this money that we didn't expect to have, both increases in state revenue, but also this increase in federal stimulus and state aid. I think the buzzword that we're all trying to look for is transformation. This is really a once in a generation challenge and also a once in a generation opportunity to think about what have we wanted to do so that we can set the trajectory for public health, for fiscal responsibility on the right path, and for healthcare, as Mark just described, trying to. We don't necessarily want to go back to the way things were. We want to set the trajectory of healthcare costs on a different path, and so this is an opportunity for us to do that. And as I mentioned, states like Colorado cannot run deficits, and for the budget that was just passed for this upcoming fiscal year, one of the remarkable things that has happened is that the state of Colorado is building its reserve base, and it's about 13% of our annual expenditures, which is at a reserve level that we've never seen before. And I think, from running a household, having a reserve is not any new idea, but for state government it is. We're running from just 1 year budget cycle, but I think having a reserve really puts us in a situation where the problems and challenges that we're going to be facing over the next few years are going to remain, even though it feels like the economy is opening up, where things are improving, but these problems are going to linger for years, and we need to set ourselves up to deal with that.
And Edmund, just a quick follow up here with a quick response, if you can. You made the joke about unprecedented. The state of Colorado has an unprecedented opportunity to take this perhaps one-time federal money and do something with it that is sustainable. What sort of process is on the ground or is being built in Colorado to try to ensure that you are making the most of this opportunity and not just responding sort of willy-nilly?
Sure. I think it's two things just quickly. One is we want to listen to what people on the ground are saying. The governor has gone through a listening tour across the state to hear what are the issues that are sort of fundamental issues that are plaguing the healthcare system that need to be addressed. I think the second thing is is to the extent that we can, we need to do this in a thoughtful manner and not rush to spend the money. And, the CARES Act money from last spring, we needed to spend that by the end of 2020, which is absolutely, it's important to spend the money quickly to deal with immediate problems. But in some ways that sort of handcuffed our ability to do things in a more thoughtful manner. And the American Rescue Plan money, the $3.8 billion that Colorado is receiving, the legislature and the governor have spent a portion of that, but we're also very, very happy that there's more flexibility in how long we can spend that, because these are not issues that can be fixed in a few months. So having that flexibility to use that money is going to go a long, long way for us to be able to make some transformational changes.
Great, Edmund. Thanks so much for the update from Colorado there. Excited to talk a little bit more with you about what's happening in the Rocky Mountain State later in this conversation. Amy, I'd like to turn to you now as we focus. Loud cars in West Philadelphia, everybody. I apologize if you all heard that. So the question is, sort of staying here focused on states, but not just one state, states in general, Amy, what comes next? What barriers are they facing? What opportunities are presenting themselves, particularly when we thinking about healthcare?
Yeah, no, thanks, Dan. It's great to be here. And it was great to hear sort of the last session, because it touched on some of the things I was going to talk about. So when this pandemic started, I was at the Governors Association working with governors and their staff. And now, of course, I'm at NASHB. And I will say, talking to a lot of different states, there are a lot of opportunities, but there are challenges. So, okay, we are now going into the recovery phase of this pandemic. And I think that has raised a lot of hope and opportunity. Edmund talked about the federal dollars flowing into the states, $195 billion going into the states, $350 billion total, which includes cities, counties, and tribal governments. So a lot of money and a lot of flexibility with those dollars. But I think there's a couple things that states have to really focus on. One is continuing to keep the public healthy. So, we're not done with this pandemic. We know that our public health system has been, long underserved and under-resourced. And we saw, what happens when you have an under-resourced public health, especially at the local level, that can't handle, the strains that was put under. So using those dollars to make sure that we're making the right investments to, for the longer term, have more sustainable change that's going to really help us when the next pandemic comes around, because it certainly could do that. And keeping the public healthy with the current pandemic, getting more people vaccinated, understanding if we need booster shots, all of those pieces, making sure data sharing is happening with these old immunization systems that didn't really talk to any other system. So those are very targeted sort of in the public health sphere. That said, I think, public health is not a silo. It needs to be linked to the other parts of our healthcare system. The Medicaid program, health plans, health systems, and how do we really build a path towards that with the dollars? I'll say one of the challenges when you think about these investments is these dollars are time limited. And for states, that's challenging. As Edmund talked about, states generally have to balance their budget. They can't, like the federal government, decide, well, over the next 10 years, we're going to spend X amount of dollars, even if we know these in the next 2 years or 3 years or whatever the timeline is, the grant dollars are going to run out. So that's going to force them to make decisions that are in some ways in the shorter term, because, if you hire a whole bunch of staff, right, that's a continued cost. So, maybe it's IT infrastructure that they're going to invest in, or projects that actually have an end date. So I think, and they have to make the decisions. Some of the states are making decisions fairly quickly, to be honest. And they're, in some states, the governors are in line with the legislature, and in other states, not as much. So that's also sort of an ongoing challenge of how they really are going to spend the money. The other thing I just wanted to say is, the reopening of our economy. I just wanted to comment on that because I'm particularly sensitive, with my work at NGA on this. So, a lot of states that I've been talking to, they're saying, we're opening back up, hospitality and, childcare centers, and we don't have enough workers. So, there are some during this pandemic, people have gone on to other things, and they are having trouble attracting folks to jobs. And so I think a question is, how are we going to position ourselves as states to really make sure we get the folks back to the jobs that really need to be filled for, state fiscal economy. And I think that's challenging. Healthcare is related to that. What's the coverage that's going to be offered, and how can you incentivize that? But that is one I think that states and governors in particular are really focused on. That's why you've seen some governors decide we're going to end the federal unemployment. We're trying to, have incentives to get people back to work. I think the other thing I'll just mention is we haven't talked about it yet is equity. I definitely, we've all seen during the pandemic sort of the disparate impacts on Black, Latinx, and Native Americans with respect to COVID case count and mortality. We all knew these disparities existed before. I think there's a new focus on how do we address disparities in the context of healthcare and beyond. And what I really hope is that, some of these dollars that are flowing from the federal government, as Edmund said, this is an opportunity that we don't get very often. How can those investments be made to really address some of the disparities? And that's going to have to be across different areas. It's not just Medicaid. It's you're thinking about education. You're thinking about, housing. You're thinking about transportation, food insecurity, all the different pieces that make us healthy and contribute to our wellness really needs to be thought about in the context of what investments are we making sort of across the board. And I will say, I think that's going to be a challenge for states. Like the federal government, these programs operate in different buckets. That's how we built them from the federal level, and that's how they've translated into operational, implementation at the state level. And so some states, I think, are really trying to make a concerted effort to look across the investments of how do these relate to one another. And, if we're trying to address, one issue over here, how's that impacted by our investments in this other bucket? And how do we bring public health into this? But that is not an easy task, and that is not how our system was designed. So maybe I'll stop there, but I'd love to get into more detail during the conversation.
I do want to, as we've gone around the horn here, I'd like to ask you a follow-up question about equity. As you have these conversations with states, are any sort of patterns or themes emerging? It does seem like at least there are a lot more people talking about equity, but are you seeing states spending any money trying to address equity issues and disparity, particularly in healthcare?
Yeah, so they've, started to make investments with like the CARES dollars, like just as the beginning of this process of, where's the race and ethnicity data? We need to do better on the data, just to even understand like where do the disparities exist. And, that was initially focused on vaccination efforts. Are we getting to certain populations? And if you were someone like me who tracks this, back in February, there were maybe 19 states reporting race and ethnicity data. We're now like over 50. I mean, there's definitely been a concerted effort to try to improve that. But I think more work needs to be done. And so that's going to require, and I think some states are thinking about this, really using some of those dollars to invest in the data systems to really tell us, kind of how do we do better here. I think the other piece is really translating into leadership positions and figuring out governance structures. A couple of states have set up, coronavirus equity task forces. Just to name one state, Virginia has a cabinet level position of an equity officer that, really connects all the other agencies and really centers a mission around equity. These are the types of things that have to be built if we're really going to be able to have sustainable investments in equity, and not just in make sure we're getting the vaccines to all the people that need to get them and understand what the data is. There has to be some infrastructure built behind it as well.
Indeed. And I appreciate you taking the time and making sure that you brought this up, this very, very critical, important issue. Thanks, Hammy. So you all have done an incredible job setting this stage. Thanks very much. I'd like us to dive into some follow-up questions. First, though, before we do that, I'd like to remind the audience, please submit your own questions. Do that via the chat box. And so the first question we're going to go to here, y'all, is using vaccine rollouts as an example. What do you think we could have been better prepared for in policy? What can we do better to equip ourselves to handle something like this in the future? Anyone, if you're really excited to answer that question, just go for it, or I can pick somebody. Hey, man, shaking your head.
Yeah, I'm happy to just offer, one thought. So, when this all started, the vaccines, for example, there was a federal database that you was supposed to work to like identify like, okay, everybody's gotten a vaccine. That database had been set up, but most of the states actually hadn't been participating in it. So, there is an opportunity for us to get the data infrastructure right this time around, modernize the systems at the state level, which are all different, the immunization systems, help, really secure the connection from the states to the federal government to have a better ability to really track and understand the progression of the disease and the ability to vaccinate and protect individuals. That's just one example that comes to mind for that question.
Any other folks have thoughts, want to respond to what Hammy just said, or any other thoughts about, it seems like based on some of what we've talked about is we've seen our country sort of attempt to throw money at these two huge problems that Mike, you talked about right at the top. And there hasn't been a lot of accountability around how that money has been used. And there's been a lot of pressure, Edmund, as you talked about, on states to try to hurry up and figure out what to do. And so there was this incredible opportunity, and it feels like there's been some missed opportunities. And so maybe Mark Miller, to you, when you think about how to avoid some of these pitfalls and the lessons learned opportunity, if there was one thing you'd like to see happen differently, what would it be? And what could it be to, we can't predict the future. So what's sort of a reasonable kind of provision that would help safeguard against some of the waste that we've seen over the last year or what plus?
Okay. I'm going to say two things. I am trying to answer your question. The last little part of the question, the waste, might not be as 100% on point. There is this tension in this country between let's depend on the private sector, or should the public sector be involved? And the initial orientation to all of this is private. The private sector, I want to be very clear, has, I think in a policymaking way, we should be more sophisticated about what makes sense for the private sector to drive things and what makes sense for the public sector to drive things. Couple of specific points. One, the distribution, say, of vaccines, I don't know about for other people, but I was monumentally confused throughout the entire process. And in theory, I don't mean to say this, I shouldn't be the kind of person who should be confused. I should know something about what's going on. But where to seek it? And was it going to be at the hospital in my area, the CVS, the grocery store, was the county going to distribute it? It was very confusing, and it made me think that if we had a robust public health system that said, go to your clinic and get a test, go to your clinic and get a vaccine, and there was, like, Maryland pulled in the National Guard and set up distribution or vaccine centers, like something that said, this is where you're supposed to go, Mr. and Mrs. Public. Because I was, on websites and, casting around like I expect a lot of people were. The second thing I want to say, and I know you said one, but so the second thing I want to say is I think the vaccine story, where there's this like the private sector, is the hero here. And I want to be very clear. Yes. But I also want to point out 15 years of NIH mRNA research that they took the last mile, to their credit. Beaucoup federal dollars in research, distribution, and the federal government negotiated a price and bought the vaccine. And my point, and that to me feels like a public-private approach to something. And I sort of feel like, for example, in the drug market, we might think of what makes sense for pure private, market-driven strategies, and what makes sense for a much more tight collaboration. Don't know if that was your question, but those were the two things that occurred to me.
That's fine, Mark. I think we actually have an audience question that does a much better job of being succinct than I was with how I tried to formulate this question. And Mike, let me try to throw it at you here. What policy or procedure could have been in place to prevent or guide some of this urgent decision making?
You know, it's hard to be specific on policies or procedures. I think it's more of a framework to kind of think about this, in the sense that you know, the way we would talk about this, others talk about it in terms of responding to a crisis. It's the 3 T's. Okay, like you're supposed to try to ideally develop policies and right that are timely, temporary, right, and targeted, right, to respond in the immediacy of this. And the challenge is that there's inherent trade-offs, right, in those three T's. Okay, and the one of the best examples of this, I think, is and maybe the simplest one is like the direct payments to individuals, right? Like at the beginning of this, right, they sent them to everybody, right? Now that wasn't the best thing to do from a targeted standpoint, but they did it, right, because they wanted to do it fast and get it out the door. And I think that trying to walk that balance is difficult, and there's going to be a lot of lessons learned from this experience. But I think the other thing is, look, maybe to state the obvious also, the politics surrounding all of this drives a lot of the decision making at any given point. Mark was kind of alluding to this earlier in one of his comments. There was a difference between the time that you had to respond with the CARES Act in March versus what they did with the American Rescue Plan a couple of months ago, where there could have been some more time to figure out that right balance of timely, temporary, and targeted at the American Rescue Plan. And the result, our estimate is that, you know, there was a lot more dollars that just went out the door, right, that probably needed to a couple of months ago. Okay, so I think the politics of this is something that we have to just obviously put on the table, because that drives a lot of the decision making here as well.
And thanks for that, Mike. Hammy, did you want to jump in real quick and add a thought here?
Yeah, just a quick thought. You know, at the start of this pandemic, really, a lot of it was left up to the states. The states had to take the lead, and they made different decisions, and they struggled, you know, when we support the governors about, like, where do we get beds? You know, where do we get PPE, where the testing? And, you know, I just think it was not as coordinated as it could have been and should have been. And it set the tone for kind of the rest of the pandemic response. And so, you know, my, you know, wish would have been, like, at the beginning, have more of a coordinated, you know, national response to what was a pandemic, and you weren't sure what the right answers were, and each state had to kind of figure it out themselves, and they struggled with it. So you know, next time around, let's have resources at the federal level that is really going to be able to set the tone and more uniform response to something like this.
And Edmund, we're not forgetting you in Colorado. There actually is a specific question for you. I'm going to ask you this next, but I just don't want to quite leave this yet. You know, nobody wants to see money get wasted. No one wants to see just sort of chaos, and some degree of this $6 trillion that we're talking about was probably not used as effectively or as efficiently.
With respect, some people do, but go on.
Okay. What is there some is there some rule book that needs to be written or constructed in some way so that then when the next crisis hits, future Congress can dust this off and have it be relevant? I mean, you know, we don't know when that next crisis, it could be 80 years from now. How do we really think about and learn from the experiences we've gone through and potentially some of the mistakes that have been made in a way that is meaningful for the next generation? Yeah, go ahead, Mark.
Yeah, and I definitely want Edmund to get into things at this point, because one of the things I really liked about what Edmund said in he's thinking of trying to make changes even in the midst of this crisis that have long-run structural impacts. And that's what I was trying to say at one point. He said it better. Make sure that I wanted to note that. Yes, I think in some narrow things I can think of, not, you know, like global stuff. I think, you know, bailing out providers in the future, there are lessons that can come out of this, you know, depending on how well off, how to, you know, a provider is, how to do accountability after the fact. and the notion of even in a crisis, if you can't spec the legislation down to, the commas and periods, can you state your principles? In that narrow context, I do think if there are future crises in which we have to infuse money to the healthcare economy, to patients, to protect patients or to help providers, there are some specific lessons that can come out of this.
Very good. Let me, Edmund, that's turn to you here. Do you have any thoughts about either the question I asked or what Mark just said, or should we just jump to the question that's teed up for you?
Let me add a little bit here. I think there are absolutely urgent needs that have to be addressed immediately, and as I mentioned before, addressing those immediate needs we have to do, but we also have to do things in a measured manner as well. And so, when I think back, our legislative session just ended yesterday, or maybe the day before, but the self-discipline that the state government exercised in not spending all the money when they had the chance is really kind of remarkable, right? They've got billions of dollars in their pocket, and there's nothing that quite like that's just burning a hole in your pocket, right? And so being able to say, okay, we're not going to let this, the end of the session deadline, which is, sort of arbitrary, right? That's not going to lead us to make decisions on a timeline that just doesn't make sense. Yes, we spent money quickly, but we also need to apply a very measured response as well to address some of these structural problems that we're seeing in healthcare. So it's a mix of things that we need to do. There's not one approach that is, I think, that will be relevant in all situations. It's sort of a shotgun approach where we've got to try lots of different things, and then there's not one magic way, either policy or procedures that's necessarily going to lead us to the perfect policy outcomes here.
The question from the audience for you is that what strategies, and we can broaden this out to the rest of the group too, but what strategies can state and federal policymakers use to create a policy that reflects complex priorities across stakeholders?
Let me jump in here just real quickly, and I'd love to hear what the other panelists.
This is your question, sir. This is your question.
So, this crisis has really led the state government and the executive branch to work in a coordinated fashion, and we're so used to each department of the executive branch sort of working in a silo, and this is obviously something that a crisis where that was not going to work. We've got to work with the folks who are running our Department of Labor, our Medicaid agency, Public Health and Environment, or Department of Public Health and Environment. And so, working across all these different units and getting away from the silos, as Hammy mentioned, was just absolutely critical. And that's something I'm hoping that is going to be able to continue as we, dig ourselves out of this crisis, and it's going to set us up for the next crisis, whether it's a public health crisis or an economic crisis or both. But I think getting out of the silos has paid off well, and that's something we need to continue to pursue.
Well, and real quick, Amy, Edmund, what setting priorities is a very difficult thing to do because you end up with some winners and some losers. How is Colorado trying to create priorities, knowing that there will be some people who are going to be on the outside looking in?
As I think Mark mentioned, that this is a political process. So in some ways, you can't avoid the fact that the loudest voices are going to get heard, right? That's sort of part of the way that the political system operates, right? But I think in this situation, the executive branch and the governor have really tried to focus on on the voices that are not heard. And as Amy mentioned, and Mark as well, that the idea of addressing inequities is very important. And so when it comes to Medicaid and the vaccine rollout, right? When I look at the big vaccination events that happened, I think that they worked well, but obviously there's a large population within the Medicaid sector where you can't just drive to Mile High Stadium and get your vaccine. That those people don't often have a voice in how this is going to work. And so having champions of people who can think about getting the vaccine rolled out to people who don't have transportation. Medicaid covers a lot of people who have disabilities and can't get around very well. And so reaching out to them was a big part of being able to set priorities and not just letting the normal political process of whoever has got the loudest voice is going to get the spoils, right? That's something that we can't let happen here.
Amy, you were going to say something.
Yeah, I agree with that. And I think, building on the conversation earlier, the partnerships that have been built between states and counties and cities and communities and the private sector, I think are going to be really key to figuring out how to identify what the best strategies are for the spending of this money. That said, not everybody's going to be happy. Never happens. That's the realistic piece of it. But there has to be some really concerted thought. And I think states have to learn from one another on this. We're getting a lot of questions about what is this state doing and how are they going to try to address IT infrastructure and what are they going to do with respect to addressing costs and value and making a difference, and how do we use ARPA money to do that? So I really think there's an opportunity for states to share with one another and for the federal government to facilitate that. And really, I have to say, over the past number of years, the federal government stepped back from that role of really providing more technical assistance to states and sort of, convening them and really letting them, share their ideas with the federal government and vice versa. And I think this is the time where, the federal government can go all in on that and really, help identify where are the promising ideas and how can we really, work together to identify the strategies. This is going to be very complicated. And I want states to succeed because, they're going to get a lot of pushback if they don't. We all know that. So.
Amy, I don't know if I don't want to put you on the spot, and if you don't have this example, that's fine. But is there an example that you can share with the audience that reflects? You talked about how important it is for these relationships to be built, whether that's between states, whether that's within a state. Is there an example that you can think of a new kind of partnership, that's something that has, frankly, even surprised you and left you feeling a little more optimistic that these new sorts of relationships are being built?
Well, I love all states, but I will say there's one example that just comes to mind just because I just worked on it in North Carolina, where they really, through their Medicaid program, they have this new opportunity to really address, domestic violence and housing and food insecurity. And they're partnering with a lot of community-based organizations to try to get that off the ground. And they're really open to having, new health plans that are coming on for Medicaid managed care July 1 to be a part of that. And so bringing all those, sources together, and there are lots and lots of other examples where this is happening. This is just the one I just happened to be thinking about yesterday. And it's crucial to the vaccine effort as well. Private sectors and employers like stepping in to be able to do that. And if you have those relationships built already, it will be easier as time goes on to really address some of these harder questions of where did the ARPA monies go.
Thank you for that, Amy. This has been a great conversation. Unfortunately, we are about out of time. So I'm just going to, obviously the audience, the virtual audience, let's all pretend that they're giving you guys a rousing round of applause right now. Thank you to all of you for participating in this panel. This has been a really nice conversation. Appreciate your candor, your thoughts, your insights, your experience. And I want to make sure folks can join us in 5 minutes for the last keynote panel in the Health and the Economy Summit, Governing to Improve Community Health. Open the survey module on the left of your screen to complete a brief evaluation for this event. Your feedback helps us plan future events. A link to the survey will also be emailed to you later today. Mike, Mark, Amy, and Edmund, thank you all so much for being here and engaging in this conversation. Best of luck to you all as you move forward.